Good afternoon, colleagues. Welcome to this presentation on the self-care practice that I'm going to be describing to you today. The self-care practice that I chose is called compassion meditation, which I think is an excellent self-care practice for myself who is looking to be a future personal support worker. So the title of this self-care practice presentation is called How Strengthening Our Compassionate Instinct Fosters Well-Being in Our Professional and Personal Lives. What we're going to be discussing today is how compassion meditation is a self-care practice that enhances wellness and improves patient and resident care. We're going to be discussing a bit of the insights that I learned from this article pictured here. And here we are, compassion meditation. We know that caregiving sometimes involves empathy distress. And this article that I read describes how compassion cultivation or compassion meditation allows us to continue caregiving without or with a decreased likelihood of experiencing empathic distress or emotional burnout, which then leads to a more sustainable caregiving. So as caregivers, we know that it's in our responsibility and it's in our interest to be present, to feel empathy, to see the whole person, and to witness and validate the emotional concerns of the client or resident. However, we also have understood and learned that empathy sometimes can erode, and caregivers experience very high degrees of emotional burnout. And so when these two things occur, there's a decreased quality of care because it's difficult to connect with the person and to see the whole person. So in the article, they described how empathy is the ability to recognize the distress or the suffering of another person and to feel what they're feeling, and how sometimes empathy can lead to empathic distress when we're not able to keep up and not able to process all of the emotional difficulties we're witnessing or feeling. However, there's another route. Instead of going to empathic distress, we can go to compassion. And compassion actually has a different meaning than empathy, although sometimes the words are used interchangeably. In this context and in the literature, compassion is described as the ability to recognize another person's distress, to feel the desire to reduce their distress, and to set an intention. And so whereas empathy is just to feel what the other person is feeling, here there's the added step of mentally deliberating that you want to do something for this person and developing an intention. Sometimes that may involve just deciding that you're going to be more present, or you're going to try to take better care of yourself to be there for the person. And so this process of going from empathy to compassion is very much strengthened by compassion meditation. And this is what the article was talking about, how medical students who are trained in compassion training or compassion meditation can take their experiences of empathy into compassion rather than going to empathic distress, which, as we've learned, has some negative outcomes. So what is compassion meditation? It's most simply a use of your imagination to try to connect with the warm and caring aspirations that we have as future caregivers, to develop awareness of those feelings, to make them very deliberate and conscious, and then to use them to set an intention. So what does that actually look like? Like other forms of meditation, you sit or lie down comfortably and you breathe and you relax. And then here you use your imagination to feel like you're in the presence of someone that you care for. And you imagine a problem that they're having. And imagining that problem, you then try to connect with your natural sense of wanting them to not have that problem. And the process of very deliberately connecting with this intention, we use some kind of phrase or some kind of idea to express this in our own minds. So for example, imagining the illness that such and such person is having, we think, may you be free from suffering, or may you be free from this illness. And this isn't a magic spell. It's a means to become more aware of the warmth that's inside of us, so that it doesn't just arise accidentally by circumstances, but that it's at the forefront of our mind. And when this feeling arises, we develop an awareness of how it feels. And the effects of compassion meditation, as documented in the scientific literature, are decreased psychological stress, decreased emotional burnout, increased sense of connectedness, increased sense of resilience, and increased enjoyment for caregiving work, which I, as a future personal support worker, and you might agree, would be very important. So that's a part of the reason why I see it as such a good self-care practice, because it allows myself to maintain my motivation and to actually enjoy caregiving or enjoy being a good friend or a good partner and so forth. So there we have it. That's how compassion meditation fits into caregiving, why it's a useful self-care activity, and there are some of the benefits. And with all that in mind, for me, it gives quite a clear picture of how it's a very good ingredient in sustainable caregiving. So I've left some more resources here for you to do some more reading if you're interested. And I thank you all for your attention during this presentation.